Hello, my name is Jonathan Martinez, and today I will be presenting my research titled To What Extent Does the United States Congress Influence the Advancement of Community Health Workers in the United States Healthcare System? This study aims to examine the landscape of community health workers' integration into the United States healthcare system with a focus on analyzing legislative initiatives introduced by the 18th Congress to understand the United States Congress influence in integrating CHW into the United States healthcare system. Community health workers, or CHW as I will refer throughout this presentation, are frontline public health workers trusted by their communities. They act as a bridge between health or social services and their communities, facilitating access to services and improving services delivery quality and cultural competence. CHW also enhances health knowledge and self-sufficient through outreach, education, counseling, social support, and advocacy activities. Currently, we have 61,000 CSWs in the United States with a projection of 144,000 um, CSWs by 2029. The majority of the work is done at the local government, individual services, outpatient centers, and hospitals. The majority of the integration of CSWs into the healthcare system has been done by states, and it is primarily through infrastructure, professional development, workforce development, and financing. At the federal level, there hasn't been much done, and the majority of the work started to be done after 2010 when the Affordable Care Act um, allowed reimbursement for CSW services. Another major development was in 2022 when the Biden administration allocated 225 million in funding to train more than 13,000 CSWs, and in 2023 uh, the Biden administration approved 50 million to work on workforce development and capacity. Due to the lack of information at the federal level, I decided to conduct this study in order to contribute to the literature. And my research, as I stated before, focused primarily on exploring the legislative climate in terms of understanding what is available at the federal level. To do this, I used the following terminology that are associated with the core principle of a community health workers. This includes community health worker, community health representative, care coordinator, patient navigator, family support specialist, health educator, care manager, perinatal health worker, and peer educator. These terms were explored in congress.gov, which is the official page for legislative activity of the United States. And this was done through the House of Representatives and through the Senate. Once I identified the bills using the criteria, I conducted a political analysis. This primarily focusing identifying the bill's sponsors, co-sponsors, party affiliation, number of supporters, and bill's status. And also with that information, I created a map for the House of Representatives and Senate to identify regions supporting CSW legislations, and as well I did a aggregate representative and senatorial support to highlight Congress support for CSW by state. In order to explore more my methodology, you can see here the formulas that I use. You can pause the video and take a further look. Also, I conducted a content analysis using the bills identified. I did this by manually coding using the DOS software, and this was focused to identify patterns, trends, and relationships within the text of the CSW bills. And then I proceed to interpret the data to understand underlying meaning, intentions, and implications of the bills. The political analysis revealed a total of 17 bills in the Senate, 20 bills in the House, with a total of 23 distinct bills. Most of the bills had identical language in both chambers. The most prevalent topics are mental health, maternal health, and workforce development. Democrats show high support, followed by Republicans and Independents. The majority of the bills are uh, in the Committee on Health, Education, Labor, and Pension in the Senate, and the Subcommittee on Health in the House. Maternal health received the most popular support by both parties, followed by workforce development, especially by Republicans, and mental health by both parties as well. Using the data from the political analysis, I created the following two maps. As we can see in the map, Minnesota, Massachusetts, and New Jersey are the leaders in the Senate. Illinois leads in the House. Significant support in the Northeast and a minimal support in the High Plains, as you can see in the map. Also, the Senate shows low support nationwide. West and East Coast exhibit the most support, and states with the highest support include Minnesota, New Mexico, New York, and Connecticut. The content analysis revealed that CSWs primarily are mentioned in legislation titles and sections. Not a single legislation was solely dedicated to address CSWs. Also, CSWs are seen as secondary actors and are embedded within larger definitions. In terms of the initiative, legislation support training and education, workforce development, and there was an emphasis in using grants to integrate CSWs in communities and also promoting a public-private partnership. In terms of the relationship between the state and the federal government, the state was found to do the majority of the work, while the federal government provides the funding and the resources. And in terms of the financial strategy, I was found that grants are the primary funding source for CSW programs, followed by state plan amendments, Medicaid, and Medicaid reimbursements. And due to the nature of these financial strategies, there is a sustainability challenge. Overall, we found that CSW integration into the healthcare system has been slow, and this is primarily due to a lack of political support, and this is evident in the legislative language and the lack of funding allocation by the federal government. Also, CSWs are positioned as a secondary actors, and we tend to overlook their unique skills and expertise. It is important crafting effective legislation strategies. Especially, it's important to highlight the cost effectiveness of the programs and the way that they can contribute to the health outcomes positively. Also, in terms of stakeholder engagement, it is important to build coalitions at the federal and state level, and it is particularly important to target the Committee on Health, Education, Labor, and Pension in the Senate and the Subcommittee on Health in the House. In terms of the state level, we I highly recommend targeting the regions of the High Plains and the South, given that there is a really low support for CSW initiative, and also to target support at the state level in order to build at the level of sponsorships for CSW legislations. To conclude, the landscape of CSW integration is characterized by progress and persistent challenges. Obstacles include limited political support and funding constraints. There is a promise in legislation as the content analysis reveal, especially focusing in maternal health and workforce development are the best routes to advance CSW integration into the healthcare system. Moving forward, strategic advocacy efforts and stakeholder engagement is crucial, and this is especially important for crafting effective legislation strategies, mobilize diverse coalitions, and also it's important to focus at the state level to build um, sponsorship for CSW's legislation. And with this is my presentation. Thanks so much, and I'm looking forward to read your comments.